So once again, thank you all for joining us today. We're very excited to have the Heart Foundation here today to share some tips on how to stay heart healthy and also share some of the exciting programs that they look after. Teresa is here from the Heart Foundation. I will pass over to her because she's the expert on this subject. But before we do that, I just want to run through a couple of things. First of all, we want to do an acknowledgement of country. So we acknowledge the traditional custodians of country throughout Australia and recognise their continuing connection to land, waters and culture. We pay our respects to the elders, past, present and emerging, and we extend that respect to Aboriginal and Torres Strait Islander people here today. As I mentioned earlier, or if you've just joined us, what we do during our webinar is if you've got any questions that you'd like to ask Teresa from the Heart Foundation or even myself from Mabel, down the bottom of your screen, as you can see on my screenshot here, there's a chat icon. So if you just click on that chat icon, you'll see a webinar chat box that opens up on the right-hand side. So if you do have any questions throughout the webinar, please drop them into the chat. I will moderate the questions throughout while Teresa is presenting, and then we will have a Q&A section at the end of the webinar. So either Teresa or I can answer any of your questions. Okay, so what I actually will do now is I will pass you over to Teresa from the Heart Foundation. I'm going to stop sharing my screen and I'll let Teresa take over. Teresa, over to you to talk us all about heart health and the Heart Foundation.
Thank you so much. Now let's see. Oh, this has gone. Let me get to the beginning of my presentation. There we go. Thanks so much, Damien and Mabel, for inviting the Heart Foundation along to this webinar or to present this webinar. And thanks to those of you who are joining us today from, it seems like, various parts of the country. As Damien said, I'm Teresa Gadaleta and I'm the Heart Foundation Walking Lead at the Heart Foundation. I'm based in Adelaide and I've been with the organisation a really long time. I tick over, I think, 22 years next month. So I've been involved in a lot of the work of the organisation and am really passionate about what we do. So today what I'm going to talk about is heart health. I'll give a quick, I guess, overview of heart health, including the risk factors for heart disease, but I'll really then focus specifically on physical activity, why walking is such a great option and how the Heart Foundation's program, Heart Foundation Walking, can support people to get started in physical activity and to keep going regularly. So I really, before I started, wanted to note that this is general information and practical ideas to support heart health. It's not personalised medical advice. So if you do have individual concerns or questions relating to your own health, then it's always best to talk to your GP or health professional. So Damien's already done an acknowledgement of country, but I did want to acknowledge that here in Adelaide, I'm acknowledging the traditional owners of the lands, the Kaurna people, and pay my respect to them and their cultures. So a little bit about the Heart Foundation and what we do. We are a charity. We have been around for over 65 years and we are a trusted, dedicated, for-purpose organisation that's really dedicated to improving the prevention, detection and treatment of heart disease. We have a lofty vision, and that is that heart health will be achievable by everyone in Australia by the year 2050. And we do this in a few ways. We fund a significant amount of high impact research. So that supports both emerging and leading heart health researchers. We advocate for policies and investment that create heart healthy communities for people in Australia. We raise public awareness about heart disease and healthy living through our campaigns, through various programs, tools, and resources. And we also support health professionals to be able to prevent, diagnose, and manage heart conditions. So to jump into talking about heart disease and the risk factors, as I said, I wanted to focus on what's preventable, but to give you an overview, coronary heart disease in Australia remains one of our leading causes of death, claiming 51 lives every day. So that's 1 in 4 deaths in Australia being caused by heart disease, or one person dying every 12 minutes. What is heart disease? It is a broad term for conditions that affect the structure and the function of the heart. And this includes coronary heart disease, arrhythmias, heart failure, and valve disease. There isn't one single cause. There are risk factors that increase your chance of developing heart disease. And the more risk factors you have, the more likely you are to develop heart disease. Interestingly, more than half of the adults in Australia have 3 or more risk factors, and many don't even know that they're at risk. So prevention really starts with knowing what the risk factors for heart disease are and making positive lifestyle changes where we can. When we talk about risk factors, there are just some that we can't change, but it is helpful to know what they are because it can help people take action earlier. Age is one of them. So as you get older, your risk increases. Gender is a factor, with men being at higher risk of heart disease relative to women of the same age, but women's risk grows after menopause. Ethnicity is a factor, with people of some origins, such as First Nations peoples and those from the Indian subcontinent, having a higher risk. And importantly, family history. So as I said, these can't change, those were can't change factors. These are the risks that we can actually influence. And this is where small and realistic steps really matter to reduce risk. Smoking increases risk dramatically. Bad cholesterol, which can stick to the walls of arteries and cause blockages, is a risk factor. High blood pressure over time, diabetes, being physically inactive, and an unhealthy diet all increase risk. So I guess I just wanted to pause here though, because when we list the risk factors like this, it can feel overwhelming. But what I want to reinforce today though is that it's never too late to benefit from small changes. When we do talk about small shifts in practice, that's what I'll cover in the next couple of slides, where we talk about the building blocks of a healthy heart. And I guess a really practical foundation here is knowing your key numbers and getting a heart health check with your GP. So knowing your cholesterol, knowing your blood pressure, getting your blood sugar checked is really important. And these check-ins and a heart health check with your GP can be a really empowering starting point to clarify what matters to you in terms of your heart health. In terms of those preventable lifestyle changes, here are the core pillars for that, which is about following a heart healthy eating pattern. So that's really enjoying a variety of fresh and minimally processed foods, which are high in fiber, low in unhealthy fats, salt, and added sugar. Moving more, where we're aiming to do at least 30 minutes of physical activity on most days of the week, And I'll talk more in a moment about Heart Foundation walking groups and personal walking plans as a practical way to achieve that. And overall maintaining a healthy weight, which is supported by healthy eating and doing more physical activity. There are a few other lifestyle supports that also make a significant difference in terms of your risk of heart disease. So being smoke or vape free is really important and is one of the biggest risk reducers. Support is available if you're considering quitting. Talk to your doctor or calling the quit line for support. Avoiding or drinking less alcohol, and importantly, managing stress and mental well-being has an effect on heart health. So I've given, like I said, a brief overview of what heart disease is the risk factors that increase risk of heart disease, what we can't change, but what we can influence. But I wanted to talk more specifically because it's my role at the Heart Foundation. This is in the space that I work in, and that's around physical activity, and in particular, why walking is such a great option for people, especially for older adults. So regular physical activity is one of the best things that we can do for our heart, body, and mind. It helps prevent heart disease and high blood pressure, improves energy, fitness, and overall health. It supports mental well-being, mood, sleep, and stress. And importantly, it benefits people of all ages and abilities. And it's never too late to start. Every bit of activity and movement counts. So what does enough look like in real life? The aim really is to be active on most days and building towards 30 minutes a day. And this can absolutely be broken down into short sessions. If someone is new to activity or returning after a break or living with health conditions, the key here is to start gently and build up gradually. It's great where possible to incorporate balance, flexibility, and strength activities as well, and to break up periods of long sitting with some light movement. Importantly, physical activity should be adapted to individual ability, support needs, and health conditions. And here is where talking to your GP or health professional is really important. So the key message here, and it's worth repeating, is that any movement is better than none at all. So for one person, 30 minutes a day of walking or physical activity can look like a 10-minute walk in the morning, a walk to the letterbox or around the shops during the day, and maybe an evening stroll. For another person, their 30 minutes might look like supported walking indoors, moving room to room with the help of a mobility aid, and maybe some walking outside as well. So it's different for everyone. And like I said, the key takeaway here is that any movement is better than none at all. Why we talk about walking specifically, though, at the Heart Foundation is that it's one of the easiest ways to move more. It's free, it's simple, and it's accessible. It is generally safe and low impact, which suits many older people. It can be done at any pace, adjusted to different abilities and support needs. It doesn't require special equipment, a gym, or prior experience, and you can fit it easily into your daily routines. So that leads us to talking about Heart Foundation Walking, which is our flagship physical activity program at the Heart Foundation. We've talked about ways or why physical activity is important, why walking is such a simple and accessible way for people to move more. But this is a program that actually supports people to do that, especially those that are less likely to be physically active. It supports them to get started and to keep walking and maintain that as a regular habit. So as I said, Heart Foundation Walking is one of our flagship physical activity programs. It is national, so it's available to anyone around the country. It is free, and it is designed to support people, as I said, to walk more regularly, to do so safely and with confidence. The program is tried and tested. It has been around for over 30 years now. It started in Queensland in 1995 and then moved to a national program in 2007. Um, it to date, we've reached over 400,000 walkers around the country. So people can participate in a couple of ways, and I'll talk about these in more detail. But you can participate in volunteer-led, community-based walking groups, which are around the country, and we've got over 830 of those groups. Or for those that prefer to walk solo or might not have the confidence to join in a group just yet, you can sign up for an individual 6-week personal walking plan. So that was a new sort of addition to this program. It launched in 2021 and it's been hugely popular as an alternative to groups and an entry point into doing some more regular physical activity. Just as an aside, I mentioned the program's been going since 1995. We actually next month celebrate the Brookside Walking Group in Queensland, which is still going since 1995. So that's amazing that they've been walking for 30 years. We also celebrate the dedication, and she's now retiring, of the volunteer leader for that group, Gretchen, who is hanging up her walking shoes after 3 decades of leading that group. So that'll be an exciting milestone and it'll be great to celebrate that next month. So as mentioned, a few easy pathways into the program. You can join an existing walking group. You can start your own walking group. You can sign up for a personal walking plan. And for those health professionals or community-based organisations, they can also support the program by referring patients to Heart Foundation Walking, or their organisation supports the establishment of groups in their local area. But I'll focus on the ways that you can get involved. So walking groups, as I said, are free and local. We've got 830 or over 830 and growing around the country. And these groups can be found on the Heart Foundation Walking website. So there is a postcode or a suburb search function where you can find groups in your area, get more information on them, and it also includes details of the volunteer walk organiser who leads those walks. The groups cater for different abilities and walk durations, and it's really the walk organiser who determines that. The groups in general seek to improve people's heart health, mental health, and importantly, social connections. So there's so many added benefits of people walking together in a group. We also have our walker rewards, which walkers can join. So they get rewarded for reaching certain walk milestones with certificates and prizes. So why join a group? As I said, small steps can lead to big benefits in terms of people's heart health. So there's that, but there's also building social connections, meeting new people in your neighbourhood. And we hear so much over the last 30 years from participants in the program who say they may have sought out Heart Foundation Walking and joined initially for health reasons, but they've stayed for that social aspect and the friendship that they've made. People feel the power of walking in a group, so they're inspired by others who are in that group, and they enjoy safety in numbers. As I said, there's ownership from the volunteer walk organisers and the group. It's very embedded in the community, and people reap the rewards of participating regularly with certificates and prizes at certain walk milestones. I did want to touch on becoming a walk organizer. It may or may not be of interest or relevant to those joining today, but these groups really, well, these volunteers really are, you know, the powerhouse of the groups and why they've got such longevity and they go for decades. Um, they bring community members together and they do so in a really supportive way. So being a walk organizer enables people to decide where and when and how often the group walks. They can promote their group through their community and encourage others to join. They're just a walker themselves, so they attend those walks, but they have that additional sort of responsibility of welcoming new walkers. And they do also submit attendance logs to us at the Heart Foundation, so we're able to reward the walkers in their group. In return, they receive from the Heart Foundation training, practical tips on managing their groups, as well as volunteer insurance cover. There's an online dashboard for them to manage their groups. They get flyers and resources to promote their group. There's support from staff in the team, as well as free merchandise for them as a thank you for their volunteer efforts. I mentioned personal walking plans as, I guess, a more recently introduced part of the program. So, personal walking plans were launched in 2021 and really is for those who prefer to go solo and walk on their own and not with a group, or like I said, those who may lack confidence to join a group and want to build up a regular walking habit themselves first. So, the personal walking plans are tailored to people's sort of current level of physical activity, and you let us know that in your registration. And then over the 6 weeks, you'll get a plan that over the 6 weeks aims to get you walking at least 30 minutes a day on most days of the week. So the plans progress each week, either in the number of walks, in the number of walk sessions, in how long you're walking, or the intensity. And they also incorporate flexibility and strength exercises as well. So there's a theme around each week, and that just helps guide the emails as well as the text messages that people receive. So the text message component of the program has been hugely popular and really engaging. And the important thing to note is that whilst you receive sort of regular supportive text messages throughout your 6 week journey, that is a two-way conversation. So you can reply to those text messages. My team at the Heart Foundation sees them and can respond back to you. So that just really helps with people starting on a walking habit and keeping going. Whiz through that, Damien. I feel like talking about Heart Foundation walking, but there's probably more time at the end for us to answer any questions. But that's Heart Foundation walking. So I guess what I've tried to do today, as I said, is give an overview of heart health and the risk factors, but really focusing in on my area, which is around getting people to be more physically active and hopefully introducing you to a great program that you can get involved in. But I did also want to end by highlighting some other supports at the Heart Foundation that's specifically for those people living with heart disease and their carers. We have the My Heart, My Life program, which is one of Australia's largest support programs for people living with heart disease and their carers. My Heart, My Life provides tailored heart health information, tools, and support to improve people's physical and emotional health and well-being. And it complements clinical care from health professionals. So it's 12 weeks in duration, again, supported with email and text messages along the way. And really that practical content in the program and behavioral nudges gets people to, helps people with those lifestyle modifications. The Heart Foundation also has a peer support network, and this is a moderated and safe virtual space that connects people that are living with a heart condition to others that might be on a similar journey. So it's really about sharing stories and experiences, normalizing those experiences and seeking validation, which can really ease people's feelings of like anxiety and isolation during their recovery. So members, yeah, in these networks provide encouragement and support to each other. So we do have two closed or private Facebook groups. So there's My Heart, My Life, the My Heart, My Life online community for those over the age of 18, and Supporting Young Hearts online community, which is for those aged 18 to 54 years of age. On this slide, we've got a couple of links. So if you wanted to find out more about the Heart Foundation Walking Program, if you wanted to search for groups in your area and join those, you can go to the Heart Foundation Walking website. There's also a page with our heart healthy recipes, so many of them and hugely popular. So the link is there as well. Ada, my colleague, will pop those links in the chat also. And for those that have a heart condition and want more info or to join the My Heart, My Life program, I've got the link on this slide as well, but it'll be in the chat also. So I guess my takeaway message today is that in terms of preventable risk factors for heart disease, small, consistent movement it really supports heart health, and walking is one of the easiest ways that you can do that. So if you're interested in being supported during your walking, then Heart Foundation Walking is a program that you can tap into. Damien, that was all I had today.
Well, thanks for that, Teresa. I might just take back control of the
Yes,
screen if you want to jump out of yours, and I'll just add some stuff from a Mabel perspective. So
stop sharing. There you go.
I'll jump back in and share my screen. And then we'll jump in. We've got some questions in the chat. So if anyone had any questions for Teresa or for myself, please let me know. Drop them in the chat and we will come to those. So just some tips from a Mabel perspective. So if you're wanting to walk some more, and you already if you have a current support worker, so have a chat to your current support worker who can help you with your walking goals, whether you want to build up your steps gradually or just get outside and have a go. A support worker can walk alongside you literally. Also, making a habit of where it's fun, so that it's easy to do. So connect with your support today, and that can bring the laughs and help maintain that newfound habit. I know, if I'm not enjoying, my leisure activities, I find it a bit of a chore. So trying to make the exercise or the walking that you're doing fun just makes that a little bit more enjoyable. And on Mabel, you can find support that, you suit your needs and personality. So if you have a support worker, chat to them about adding walking to, when they come and do your supports. Or if you're looking to commence starting to walk, and it doesn't have to be walking, it could be another physical activity, and you want to find that support on Mabel, you can certainly do that. Again, as I said, don't forget to bring the laughs or ask for some laughs, because it just makes that exercise that little bit more enjoyable. And if you are looking for that support worker, we've got a position description here. Hello, my name is Anne. My name's not Anne, but we'll just say for this example it is. I'm looking for a support worker who can make my daily walk fun. I like to walk with someone who's funny and lighthearted and doesn't mind staying at my pace. So if you currently don't have that support worker and you're looking to add a support to Mabel, there's maybe a suggestion on how you can create a job post on the platform to find that ideal support worker who can assist you with your walking or your exercise that you're looking to do. On Mabel, we have ways of where you can get support. So there are 3 ways that we can help you from a Mabel perspective. So we have our phone support, and there's our contact number there. So you can reach us on 1300 736 573. And our team are based here in Sydney, and they are available between 9 a.m. to 6 p.m. So just remember that's Australian Eastern Standard Time. I need to update my presentation because I still got daylight savings in there, but it is 9 to 6 Sydney time. We also, if you jump on to our website, we have a live chat there where, again, between 9 and 6, Monday to Friday, you can jump onto the Mabel website, jump onto the chat and have a chat with one of our support team. And we also have lots of help centre articles on the website. So if you go to mabel.com.au and go to the help centre, you can find lots of ways or tips on how, of anything to do with Mabel, like posting a job, finding a support worker. Our help centre's got lots of helpful articles there that you can utilise to make your usage of Mabel even more enjoyable. I'm going to jump into our questions and answers. We had a few. Oh, I've gone to the thank you for joining us too soon. I'm just going to jump into my questions that I had. We had a question from Clara. Teresa, any advice on physical activities for disabled or for someone who is potentially unable to walk people?
Yeah, it's something to talk to your health professional about, Clara, a little bit further, but to, I guess, give you an insight into some of our Heart Foundation walking groups. They do vary, as I said, in terms of how long, how far, the type of walking group that they are. And we often partner with local organisations to flex, I guess, the model. So if you're unable to walk at all, then I'd speak to a health professional about some alternative physical activities that you can do. If you can walk a little with some support, then it might still be worth having a look at some of the walking groups in your area because, as I said, they vary. Damien, I'm not sure if can I grab a screen share back and just show
Yeah.
people what the website looks like?
I will stop sharing and back over to you.
All right, let me see if I can. So this is what the website looks like. So where we go to join a walking group, you can pop in a postcode and search. So this is my area in Adelaide. So if I go to the Arndale Mall Walking Group and go to info, it'll give me all the details there. So this tells me when they walk and what time, pace medium, wheel friendly, yes. So there is a lot of information there that hopefully can help guide you to see if it is a group that might suit you. We've also often got little bios for each of the groups. So here are the Arndale Mall walkers who walk inside a shopping centre, which is surprising to some people to hear that we've got shopping centre walking groups, but they are hugely popular, especially for older people, people living in much warmer climates. There are a lot of shopping centre walking groups in Queensland, for example. But that is a really great option for people who might have mobility aids, who want a well-lit, climate-controlled, safe space to be walking. Indoor walking is a great option. So it would be worth still checking out the website, having a look at the groups in your area. And as I said, you can find out quite a lot about them. Also, it gives you details for the volunteer walk organizer who leads the group. So this is Alison, and you can get in touch with Alison by sending her an email. So, Clara, I'd still jump on and maybe, yeah, as I said, investigate or have a look into some of the details of the groups that are in your area because they might still be suitable. And lots of the groups sort of adapt or modify their sort of usual walks if there's people joining that might not be doing regular physical activity yet or not feel as confident. They're a really supportive environment to do that. So I don't know if that helps, Damien, just having a look at what those group pages and group info looks like on the website.
Yeah, no, that was really interesting. I was, when we were having our chats before, I was unaware that you had wheel-friendly walking groups, so that's really really good for accessibility. Another question that did come through in relation to the walks is, can you talk around, the time, like how far or like distances, how time frames, the usual
Yeah.
walks are?
Yeah, many and varied. And again, I guess it's the benefit of people starting their own group is they'll do it at a day and a time and a pace and a duration that suits them. So it's really the people that start these groups that determine all of that. So the Heart Foundation doesn't sort of come in and set them up. We sort of support volunteers who then go on to establish their groups. So, we can have a 90-minute fast-paced hike in the Adelaide Hills, or it can be an indoor walking group at a shopping centre that caters to people of all abilities, really. So really the volunteers determine that. Also, often the other organisations that we partner with to set up walking groups. So as I said, they could be such different organisations. We might work with council to set up groups in that council area, or we might work with a particular organisation to set up groups in a specialised setting. So sometimes it's been retirement villages, and there've been a frame walking group, and groups like that have the option of being closed or private groups, which means, Damien, that they're not searchable on that public website, but sort of promoted within that setting and to their clients or customers. So yeah, they're not sort of widely promoted that anyone can join. So that's where we see a lot of those really specialised groups. We've got a lot of peer support groups that are established from partnering with MND for a group of carers. And it sort of, becomes more than just physical activity. It really provides like a peer support network for those people joining.
It's awesome. On the website that you were just showing, does it
Mhm.
outline each group's kind of walking pace and stuff like that? I know you said you might have fast-paced
Yeah.
groups and groups that
It
go,
does.
yeah.
Yeah. So on the page will be the walk duration. So, 30 to 45 minutes. The pace, slow, medium, fast. Terrain, if they're dog friendly, wheel friendly, and also if they socialize after the walk. That is such a big part of the program, is that social component. So that's part of that group description on the website. For some of the groups you might jump on and it says unknown, which means we haven't necessarily gotten all that information from the group, but the walk organizer is there to get in touch with and ask any questions that you might have about the group and see if it's something that would suit you.
Awesome. We had a question here from Samira. Um,
Yes.
can COVID impact heart health, and is it reversible? If so, how?
I'm not the one to speak to about this. I can't answer that today with any confidence, but it is something to speak to your doctor about. And I'm not sure, Damien, I might have to follow up any this after the webinar, and I can always send it through to you. If there's any information that's available on the Heart Foundation website, I'll have to check on that one. Sorry, Samira.
Sorry, Samira, we couldn't answer. When I read the question, I thought, oh, that could be a tricky one.
It is a tricky one. I wouldn't feel confident answering it on the spot.
That's all the questions that we have in the chat. Did anyone else have, who's joined us today, a question for Teresa or for myself from a Mabel perspective? While we're waiting for that to come through, Ada from the Heart Foundation has put some links into the chat. When I send the email tomorrow out to everyone who registered with the video of today's webinar, I will include the links that were in there. So if you haven't gotten them, don't worry, I'll send them to you in the email. Oh, we do have a question. It's from Samira. She said, for over 75s, what is the minimum distance to walk per day for ideal heart health?
Not a distance as such. As I said, older Australians should be aiming for 30 minutes on most days of the week. So not a distance, a time. So like I said, that doesn't need to be done in one burst. You can break that down into like shorter, like 3 10-minute bursts. But yes, Samira, not a minimum distance, but aiming for 30 minutes a day.
Thank you. Awesome.
You're
Thank
welcome.
you. Well, I think that wraps up our webinar for today. I want to thank Teresa and Ada, who's been in the background supporting Teresa today from the Heart Foundation. Coming into this webinar, I was unaware of all the programs that the Heart Foundation does, and especially their walking program. So, and I think that it's really exciting what they're doing. I think a really great way to get out into community and to, whether it be for health or whether it be for socialization. There are a lot of great wins for joining up to the walking programs. And if the walking program isn't for you, as I said, speak to your support worker. Get out there and utilize them to help you do some exercise or some activity on a regular basis, and make it fun. As I said, it's always fun. You enjoy it a lot more when it's more fun rather than a chore. So thank you everyone for joining us. Thank you, Teresa and Ada.
Thanks, Damien.
We appreciate your time, and look out for the recording with the links. We'll send that email out around this time tomorrow to everyone. Thank you all,
Thanks,
and hope you have a
everyone.
lovely afternoon.
Take care. Bye.
Bye.